One of the biggest hurdles to clear during this pandemic, and this week especially, is the safe return to school. So let's talk about that for a bit. Kids, parents, teachers, principals, and school boards are all wrestling with the unprecedented challenges they're facing, as well as a lot of uncertainty about what's coming. MHA has been working with stakeholders in identifying the supports the educational community needs to make the return to school, whether in person or virtual, a mentally healthy one. It isn't easy for them because they're facing enormous stress and pressure to get this right. And part of the challenge is making sure they have the emotional supports in place that they need. You can find some of these on our website, mhanational.org, in our free downloadable back to school toolkit. Our next speaker, Leslie Boggs, represents one of our partners in the effort. As president of the National PTA, she has a broad perspective on what kids need. She's been working closely with parents and teachers across the country to make that happen. The PTA's mission is every child, one voice, and it's developed a powerful call to action for the federal resources needed to support all children and their parents, teachers, and support staff and administrators in their return to school. And here to talk about what the PTA has observed these past few months and what its 4 million members are urging now in response to the crises we face is PTA President Leslie Boggs.
Hello, everyone. Thank you to everyone at Mental Health America for having me here at your annual conference. I am here today on behalf of National PTA, the nation's oldest and largest child advocacy association, with over 22,000 congresses in all 50 states, DC, the U.S. Virgin Islands, Puerto Rico, and Department of Defense schools in Europe. That's right. Your child's school PTA, the one that planned the school carnival and fundraised to build the computer labs, is part of a nationwide network of families, educators, and community leaders dedicated to making every child's potential a reality. I'm honored to serve as PTA's 56th National President. Here's something else you may not know. For over 120 years, National PTA has been a strong advocate and a reputable resource for millions of parents, teachers, grandparents, caregivers, foster parents, and other caring adults who share a commitment to improving the education, health, and safety of all children. We speak with one voice for every child in this country. Our association was founded on the belief that we can do more together than we can apart. And advocacy has helped us establish universal kindergarten, the National School Lunch Program, the juvenile justice system, and anti-child labor laws. I have seen firsthand how much we need each other in this time of crisis. The old saying, it takes a village to raise a child, is still real for us. We all need some help every once in a while, and PTA is the village square, the gathering place where the magic of community happens. It's where we come together to solve problems, celebrate with one another, and plan for better days ahead. PTAs across the country are working hard to help school communities navigate the challenges that have arisen from the pandemic, focusing on social and emotional well-being, addressing food insecurity, creating resources for family engagement, demanding greater support for distance teaching and learning, and bridging the digital divide. Over the last few months, I have listened to hundreds of heartbreaking stories that had inspirational results. Thanks to the generosity of our sponsors and partners, National PTA has been able to establish a COVID-19 PTA relief fund and award over $1.27 million to PTAs across the country to help them better support their communities during this crisis. These communities have done some incredible things. And in my home state of Texas, one PTA established a food pantry and delivery service with the funding, knowing that many parents had lost their jobs during quarantine. During one delivery, one grateful mother whispered to a PTA volunteer, "I guess we won't have a ketchup soup tonight. Thank you." As a mother myself, I can't imagine the emotional pain of not being able to provide for my child. I'm so grateful for the strong partnerships we have with parents, educators, and school leaders to help them solve the physical needs that this pandemic has created. But we must not neglect the severe mental health aspects of this crisis. Prior to the pandemic, PTA members were deeply concerned about the increasing number of children suffering from mental and emotional health and wellness conditions. And significantly, out of the 1,000 applications we received for these COVID relief grants, over 60% chose to specifically focus on mental health, demonstrating the strong need. Early detection and treatment of mental disorders is imperative for student success. Half of all students ages 14 and older who live with a mental illness drop out of high school, the highest dropout rate of any disability group. And these youth also experience higher suicide and incarceration rates. According to the National Alliance on Mental Illness, 20% of youth ages 13 through 18 live with a mental health condition, meaning that the odds are that in every classroom, in every school across this United States, there is at least one student with a mental health disorder. The situation has only been worsened by the pandemic. Children thrive on a sense of routine and stability. And of course, our normal routines have been severely disrupted. The stress of this moment is also compounded by the fact that the majority of young people who receive mental health treatment do so at school. And these usual diagnosis and treatment routines have been disrupted as well. I recently heard from one of our PTA members, Elisa Shook, who is a school counselor in Maryland. She told me, since the pandemic, the physical distance has taken its toll on many young people. Students are no longer really worried about whether they're accepted by their peers or if they will get a good grade on an assignment. Instead, students are wondering, will my parents die? Will I die? Are my friends okay? The burden of these questions and worries follows on parents, causing an immense amount of stress. Families are supportive, but struggling with their own worries and anxiety. This school counselor's fellow PTA members knew that they had to find some way to support their students, despite school closures. They decided to use grant funding from the National PTA COVID-19 Relief Fund to coordinate with counselors to establish a virtual mental health and social emotional support program that will enable parents and students to learn strategies and find resources. Unfortunately, we know that not every community is equipped to do this kind of work. Therefore, National PTA partnered with 5 other organizations to establish Shine Light on Depression, which is designed to create real and hopeful conversations around mental health. Through classroom programs, family workshops, and students clubs, we hope to ease the stigma of depression and increase access to mental health resources. National PTA is also doubling down on our programmatic commitment to mental health. We convened a working group this summer with over a dozen leaders in the mental health and school space. And coming out of that, we will be launching a brand new mental health webpage next month that connects families and PTA members with resources to better understand and take action to improve mental health. We will also provide training to PTA leaders on mental health because we know how important it is for school leaders to understand why mental health is so important, as well as what they can do to improve it in their own school communities. PTA also recognizes that COVID-19 has shone a bright light on the long-standing systematic health and social inequities among communities of color. CDC data shows that Black, Brown, American Indian, and Alaskan Native persons are at increased risk of getting COVID-19 or experiencing severe illness, regardless of age. Dealing with the effects of COVID-19 and the recent protest against racism has taken an immeasurable mental toll on families of color in our nation. As an association that represents all children and families, PTA believes it is therefore important and our duty to disrupt the systems that propagate institutional racism. That's why the National PTA Board of Directors recently passed a position statement addressing institutional racism to help guide PTAs across the country. It outlines how together we can be intentional, purposeful, and relentless in our efforts until every person enjoys the freedoms guaranteed to all Americans. First, we must listen. We encourage PTAs to have courageous conversations with their school communities to understand the impact of institutional racism and how it affects the well-being of children of color. This includes discussing related topics such as social justice, equitable education, juvenile justice, affordable housing, food sustainability, economic wealth, and affordable health care for families of color. Next, we must educate ourselves and our communities. It is important that we can identify the disparities that exist among students of color compared to their white peers to understand the resulting impact on school performance, academic achievement, and graduation rates for students of color. This means we must invest in educating students and teachers on the history and impact of institutional racism. We must also provide training for all school staff on implicit bias and culturally appropriate curriculum, as well as professional development offerings for mental health, trauma-informed care, and restorative justice to provide a safe, inclusive environment for all students. We can't do it alone. And that is why our position statement also calls for us to advocate for the change we need. We need to speak out with a loud collective voice at all levels to eradicate the negative impact of institutional racism. That means we must compel our federal and state policymakers, school district leaders, and school administrators to invest in the critical training needed. And these decision makers must also work with educators to review the curriculum, policies, practices, and programs to identify and address bias that perpetuate inequities toward children or communities of color that result in what we call the achievement gap or opportunity gap. PTA recognizes that action at the local level has a direct impact on our communities. Our school PTAs frequently speak up at school board and city council meetings, host letter writing campaigns to elected officials, and meet with their members of Congress. We are encouraging our local PTAs to focus their advocacy on issues such as disparate discipline, equitable education for immigrant children, recruitment and retention of Black and Brown teachers, housing development policies, access to healthcare, and juvenile and criminal justice. At the federal level, National PTA has called on Congress to provide additional resources to support students and their families, public schools, and the educators and staff that work in them. Specifically, we are demanding fiscal investment in 5 areas. The first one is emergency funding directly to states to support local education agencies. The next emergency COVID response must provide at least $175 billion in emergency funding directly to states to support K-12 education. Second is the support for federal categorical programs. With the devastation facing state and local economies, the student population will be significantly needier this fall. We've urged Congress to provide $13 billion for the IDEA and $12 billion for Title I in addition to funding provided through the end of the fiscal year. Third is emergency funding for remote learning. This spring, schools and families found themselves in the never-before-found situation of widespread home-based learning. This fall, we must not repeat the long documented and persistent inequity as it relates to access to broadband. Congress must include $4 billion in funding for remote learning through the E-rate program. Fourth is family engagement in education. In addition to supporting students, many families have become and will continue to be their child's primary teachers in this virtual learning situation. National PTA has urged Congress to provide a one-time infusion of $245 million for the statewide Family Engagement Centers program to enable them to support the needs of families, children, and educators during this crisis. Last but not least is funding for school nutrition programs. Congress must continue to increase funds for food and nutrition services at USDA to prevent, prepare for, and respond to food insecurities, and to help schools adapt to new food service and meal protocols. You can add your voice to our federal advocacy efforts by sending a letter to your members of Congress through our PTA Takes Action portal on pta.org. This is how PTA is the village square of our school communities. We believe in protecting and nourishing the whole child and working together to help each child thrive in school and in life. That means supporting their physical and emotional health, as well as addressing environmental changes and challenges that make it difficult for them to learn and grow. We truly believe, as writer Margaret Wheatley once said, that there is no power for change greater than a community discovering what it cares about. All of you here in attendance today at Mental Health America's annual conference have discovered what you care about. You are a powerful force for change. Please know your efforts are deeply felt and deeply valued in so many communities across this great nation. I hope you will consider joining your local PTA or partnering with us so that we may amplify your efforts. Together, I know that we can make every child's potential a reality. Thank you so much for having me here.